Hi, my name is Lucy Wronski and I'm a doula. In this video, I will describe the 4 stages of labor. In the first stage of labor, it's called the dilation stage, and this is from when labor begins and concludes when you've reached 10 centimeters dilated. Your cervix is 100% effaced, which means it is completely thinned out, and ends when you are ready and to deliver your baby. This first phase During this first phase, you may find that your amniotic fluid is either leaking or you may actually have a gush of amniotic fluid. Your bloody show or your mucus plug might come out, and that's the mucousy, bloody substance that you may find on your underwear. There's nothing to be alarmed of. But there are 3 phases within this first stage of labor. The first phase is the early phase. And this is when you begin to have your contractions, when you start feeling them. You feel something that is different, something doesn't feel normal. You may feel mild menstrual cramps. You may feel some back pain. During this phase, this lasts anywhere from 6 to 12 hours on average, maybe less, maybe more. If you've already had a child, it's usually less time. But again, it's all dependent upon you and your circumstances and your baby and how things are progressing. So during this process or during this phase, you will be having contractions that last anywhere from 40 to 60 seconds in length. And they start out about 20 minutes apart. And as time goes on, the contractions would be a little bit more intense and a little more frequent. So you'll get to your contractions will be every 20 minutes, then maybe every 15 minutes, then progress to like every 5 minutes usually. So the frequency is every 5 to 20 minutes during this phase, and the length of your contraction is anywhere from 40 to 60 seconds. During this phase, and especially in the early part of it, you're going to find that you can pretty much do everything. You can eat, you can drink, you can take a shower, you can pretty much move around uninhibited because at this point the contractions aren't that intense in most cases. And during this phase, you will be able to you'll be able to just do things unencumbered, but you may still need to use your comfort measures when things get a little more intense. Now, this phase continues until 6 centimeters dilated, and that usually occurs when you're about 5 minutes apart. Your contractions are 5 minutes apart. At this point, you are now entering the active stage or active phase of the first stage of labor. So now during this phase, your contractions are going to be a little more frequent, a little more intense. They'll last from 45 to 60 seconds in length. But now your contractions are anywhere from 2 to 4 minutes apart. So now your contractions are 2 to 4 minutes apart. It's really important to try to relax between the contractions. Now, during this time in the active phase, again, you are able to you need to use your comfort measures more. The breathing will be more important. Using the breathing techniques, relaxing when you can, because this is where the baby again is moving through the birth canal and preparing for birth. So the contractions are being more intense to move the baby along. The third and final phase of stage 1 is the transition phase. This is where the baby is now into the birth canal and is almost beginning to crown and getting ready for you to deliver. This is the point where this phase will go from 8 to 10 centimeters, can last up to 3 hours, maybe less, maybe more again. And now your contractions are 1.5 to 2 minutes apart, and they last anywhere from uh, 60 seconds to 90 seconds. Once you've gotten to a point where you're 10 centimeters dilated, now you're going to enter the second stage. And the second stage is the pushing stage or the birth of the baby. This stage can last up to 3 hours on average. And you're going to feel the urge to push at this point. You need to make sure you're resting when you can. The contractions may be less frequent, but when they do come, when you're feeling the urge to push, the doctor will then instruct you on what to do. You will be pushing multiple times during each contraction, and each push will be anywhere from 5 to 7 seconds in length. But again, your support partner will be there to help you. Me as your doula will be there to help you, to count with you and to remind you of what you need to do. And all the medical staff will tell you what you need to do for how long and when. Now, it sounds like it may be very difficult, but you're going to try to relax and relax your pelvis as best you can and relax when you can between contractions. This stage will continue until you deliver first the baby's head, then one shoulder, the next shoulder, and then the rest of the baby will come out. If there is an issue with the positioning of the baby, you will be informed by the doctor, and the doctor will tell you what to do at that point, which is why it's very important that we pay attention to what the doctor is saying at this time with regard to when to push and when not to push. So now your baby's born, and they're going to take care of the baby, make sure that everything is good. They're going to check out the baby, they're going to check you out, and you're going to have the baby on you skin to skin. Now you're entering the third stage of the labor, and this is the delivery of the placenta. Now, this could take a few minutes, and it can take up to an hour. You will have some contractions during this time, and the contractions will not be as intense, but they will be part of the process of pushing out the placenta. The doctor may also do some massage to help get the placenta moving, but this is the phase where the placenta is delivered. This is also the point where the doctor will clamp the umbilical cord, and the baby, the umbilical cord will be able to be cut. A lot of times people would like their support partner to be the one that cuts the umbilical cord. You may want to talk to your doctor about delaying cutting until all the blood from the cord has gone into the baby, because this is very high, this blood is rich in iron and is very good for the baby's immunities. So you may want to ask a doctor to delay the cutting of the umbilical cord. Now, there's some people who opt to uh, send the umbilical cord blood to a cord blood bank. They're finding that this blood has a lot of stem cells in it, and have been successfully used in treating various cancers and blood issues and immunocompromised people. So if you choose to do this, you need to let the doctor know in advance. You need to get a kit from the cord bank companies. And there's if you need assistance with that, you can find out more about that. But if you're going to do that, you need to give them advance notice, and you need to prepare about 2 months in advance for this. So just to keep that in mind. Also, some people do opt to keep their placenta. If that's something you would like to do, you need to let the doctor know in advance as well, so that you can have a pack prepared for what you need to do in order to do that. But again, during this placenta, the delivery of the placenta, they will be monitoring you, they will be checking on the baby, but you will be skin to skin. And then once the placenta has been delivered, and the umbilical cord is cut, now we move into the fourth stage, and that is recovery. And this stage lasts anywhere from for about 2 hours, but it can be longer if you want. This is where, for the first hour, the baby will be continually checked and monitored, and your blood and blood pressure and your statistics will be your vitals will be checked every hour for the first hour. I mean, frequently for the first hour as well. But during this time, this is where you're going to be doing a lot of your bonding. This is where the baby now is no longer in the womb and is now transitioning physiologically and emotionally to the outside world. And you are transitioning from being physiologically and emotionally a pregnant woman to now being a mother. And you have your baby in your arms, hopefully, and skin to skin. And this is where you may begin to breastfeed if that is your choice, and where now the bonding begins. And during this time, you want to relax, you want it to be quiet. You may have some pain. Um, if you did have an episiotomy, which is the cut between the vagina and the anus, if that was necessary for your tour, you may feel pain from that. And I should have mentioned that during the third stage, during the delivery of the placenta, they will also be stitching you up if that is needed, if you did tear. Um, but so you may feel some discomfort, but things will be calmer, hopefully, and quieter. And you want to take as much time with the baby as you want to before you start bringing in other people. So those are the 4 stages of labor. And I hope if you have any questions, that I can answer them for you. Thank you.